I'm a dermatologist at UC Davis currently in Sacramento. I'm a graduate of Touro, Nevada. I was a graduating class of 2010.
So you're an alum. You did your first residency in internal medicine. Do you mind sharing a little bit about that? And then your transition into dermatology residency program.
Yes, my journey was definitely non-traditional and non-linear, but it helped me develop more depth in my practice in dermatology. I began with an interest in medicine with special interest in oncology. I have done a few years of research in radiation oncology before, and I wasn't completely sure what I wanted to specialize in, but I thought the idea of going into medicine was good at the time because I would expose myself to diverse disciplines. And so I completed my internal medicine residency, worked in a hospital setting, worked as a hospitalist for 4 years. And then I discovered dermatology. From then, I did 2 clinical dermatology and research fellowships and did 2 years of working in a dermatology clinic in a rural setting, and then went to a dermatology residency and completed my dermatology training. So it was quite a circuitous route, but because of that broad background, I feel that I'm a much better clinician than I would be had I not done that route.
Thank you. That is amazing actually, because we're also coming from like a DO program and then we don't have a derm home program. So I was just wondering, because I do hear that a lot of people say, oh, you need a research area, you need a research fellowship if you're pursuing derm. So what are your thoughts about that?
I feel that it's definitely valuable. I did 2 clinical research dermatology fellowships. I didn't just do research. I did mostly clinical dermatology. I went to lots of lectures, conferences. I also joined in with residents in their didactics, and I read their board review books with them. It was very valuable. It's definitely helpful to immerse yourself in dermatology settings so you can see if you're a good fit for dermatology or if dermatology is truly your passion. And so I highly recommend it to anybody considering dermatology.
I guess I have a question. So, do you do more like, is it more like med derm as opposed, or like, what is, I guess, your like day-to-day dermatology kind of?
Yeah, there is a huge need for medical dermatology. Medical dermatology often ties into aesthetic cosmetics and surgical dermatology. So when you do the skin checks and do mole checks, and then you would often diagnose skin cancers and cysts. And patients will often desire that you, the diagnosing dermatologist, to perform surgeries. So you would have lots of opportunities to do surgeries. General dermatology, you would see a lot of acne, rosacea, and then pigmentations. So you have opportunities to counsel your patients on what kind of skincare to use or what kind of procedures to pursue. So those general dermatology patients often feed into your cosmetics or surgical dermatology. So one of the questions you gave me said, how did I get interested in dermatology as a Touro student with passion in dermatology? How did I navigate in finding connections with dermatology? I didn't know I wanted to do dermatology. I remember vividly one day Dr. Del Rosso came in with many slides, and one of the lecture slides was condyloma, and he blew up in a huge 2-story tall projector or the screen. I felt like it was a very visual, but it was a little too graphic for me. So I thought that I would never become a dermatologist. But surprisingly now, that's what I practice, what I do every day, and I do gain satisfaction out of helping my patients with their skin diseases. I guess you never know what your future will look like, so have an open mind and try to expose yourself to as many fields and as many clinics settings as possible.
I personally, I guess I had a lot of concerns coming in as a student with interest in dermatology because it was kind of brought to me that like it's one of the most rigorous fields in terms of matching into the residency and all the other stuff that we have to complete for the application. So I guess little tips for advices as someone who already went through the entire process, even if it's not like specifically for dermatology matching, but just matching and residency in general, if you have any tips, or even tips for rotations, because I think majority of us are going into rotations this fall. And then I'm personally dreading it because I'm an introvert. So if you have any tips.
Before you do audition rotations, you want to do as many regular rotations as possible. There are common things that many people emphasize on. Try not to ask questions in the patient room because oftentimes the attendings are trying to go through the patients and then they don't want the flow disrupted. Sometimes they have the train of thoughts and then they're having conversations with the patients to build a rapport while trying to address their concerns. Ask questions outside of the rooms and read up on each diagnosis and then bring up any questions you may have right before lunch. That's a good time to ask. And then stay engaged and see what kind of repetitive, mundane things that the doctor is doing that you could lend help, which is one of the ways to contribute to the clinic flow, which may be difficult when you go into your audition rotations. But if you have had those experiences in your other rotations, and then it'll become easier to figure that out.
I have a question.
Yes.
I know you said that your path into dermatology wasn't linear, and you first went into internal medicine and then went to derm. If you were to know that you were interested in derm while you were still in med school, is there anything that you recommend to do as a second, third year med student that could help improve your chances of getting in?
Definitely do research. Try to find research mentors, as many people as possible. Find research projects through residence, attendings, and then try to pursue as many audition rotations as possible. If I was in medical school, in my case, I would probably do a research year between third and fourth year of medical school for myself, but everyone's path is just different. I feel that there is a value in doing a research year, especially in an academic institution. It gives you a leg up, although it's still possible that you may not match, but after a year of research fellowship, you will have more clearer mindset about whether dermatology is for you or not. It'll be helpful.
I just have another question in regards to that, like a follow-up to that question. I know next year, if you were to apply for a research year, you'd either be applying for a research year or you'd be applying for like audition rotations. So what I kind of have like a question of like how you would decide on whether you should take that research year or do the audition rotations. Like at what point would you know which one would be better for you? Is it just based on like preference, or how would you know if you just went into audition rotations that you wouldn't need a research year after?
I know it's not that easy to secure a research year. If you secure one where you can find mentors, go and spend a year. I don't think you could easily land a research year as a medical student, especially a paid one. But if you have parents who are willing to keep you in their house for a year, and then if you can do a research year close to home, that's something that you can consider.
Dr. Park, thank you for your time today. I just had a quick question as well. You mentioned a little bit about rotations earlier. I just wanted to kind of follow up on that as well. So for the audition rotation, what would you say the programs are kind of looking for in a student? Because they know when we come in, like, we don't have the knowledge base, obviously the extensive knowledge that everybody else has. So is it more just like how we fit in well with the team flow? Is there just working well with others and contributing to the clinic? Is that pretty much kind of what they're looking for in students when they're assessing candidates?
Exactly. They don't expect you to know dermatology, especially in-depth dermatology at the resident level. They're looking for someone with good personality, someone who would fit into that culture and who would be helpful, and then who would go out of their way to lend hands to help with the clinic flow or to improve the residency curriculum. Someone who is proactive. If you're someone shy like me, then you kind of have to break that barrier and then try to put yourself out there and leave an impression. Fortunately for me, I already had multiple years in dermatology, so they saw that I had some knowledge, which was very helpful, but I still had to kind of overcompensate to show my other side of me. I chime in when I was given an opportunity to speak up. Now, they also give you an opportunity to present in audition rotations, practice a lot, because they're also looking for your presentation skills and how you approach the questions that they ask you. Will be some main areas to focus as a DO applicant with interest in dermatology. Right now, building a strong research portfolio is something that you could do. And then later in the third year, apply to as many audition rotations as possible. Applied widely, don't just focus on one or two dream programs. Meet as many people in dermatology as possible, go to conferences, go to meetups, collaborate with your student peers, share knowledge, because it's not about your merit, it's more about your luck that gets your foot into the door. So if you stay persistent and then if you continue to stay in the room, then you would eventually be in dermatology. I had a very different journey. It took me a very long time to get into dermatology, but I am very happy I found this field and I am doing what I love.
I guess it was a long journey for you, and but I'm assuming that if you were to do it again, then you would totally do it. It's like that worth.
It took me 25 years since starting college to become a board certified dermatologist. If I go back, I would probably do it a little differently, knowing what I know. But if I do things differently, I wouldn't be the same kind of dermatologist. I'm somebody with a lot of self-doubt. I always struggle with imposter syndrome. But when I'm in the clinic with my patient, I feel very confident with my knowledge and skills. And I feel that I am finally able to give them the best care possible. And I feel good about that.
I had another question, kind of in regards to going a different path. Say, I know there are ways that you can do some sort of dermatology, maybe like the aesthetics portion.
Right.
A lot of other doctors who aren't board certified dermatologists can do like dermatology on the side. What is your opinion on that and the different routes that you can go in regards to maybe you're not fully set on dermatology and you'd like to do some stuff on the side versus becoming board certified.
If you want to become a leader in aesthetic dermatology, and if you want to teach other dermatologists in cosmetic dermatology, then you would have to become a board certified dermatologist. But in reality, plastic surgery or ENT, ophthalmology, or even internal medicine, and then do a lot of rotations in cosmetics. And then you can also learn through industry sponsored. If it's not something that you want to be at the next level or at the leadership level, there are many different ways to practice that.
What if you wanted to do like derm path or something? I know like a different doctor that came and spoke to us in the beginning of the year, maybe last year. She said some people can do dermapathology. You can do fellowships in like cutaneous diseases or whatnot. I don't know exactly what she was saying, but there's like ways to not necessarily match into derm and be derm certified, but practice certain aspects of derm. So I just wanted to get your ideas on that.
About derm path, there are different pathways. You can become a dermatology resident and apply for dermatopathology fellowship, or you can become a path resident and apply for dermatopathology fellowship. There are those two pathways. I don't think you can apply to dermatopathology fellowship if you're not a dermatology or pathology resident.
Thank you so much.
If nobody else has a question, I think this is a wrap. And thank you so much, Dr. Park, for attending and talking with us. And
you're welcome. Thank you for the opportunity to talk. And I'd be happy to have another session like this and then answer more questions.
Yes, and if we have any further questions, we'll definitely reach out. Thank you so much. And I guess this concludes the session today. Thank you so much for coming.